Welcome to Fertile Talks with Dr. Yemi Famuyiwa, a space where science meets the soul of fertility. Today's episode is proudly sponsored by Montgomery Fertility Center, a unique concierge fertility practice in Rockville, Maryland. At Montgomery Fertility Center, we combine compassion with precision science to meet every individual's need. It is a place where you'll feel heard, supported, and truly cared for. If you're ready to begin your fertility journey or just need clarity on your next steps, give us a call at 301-946-6962 or visit us online at montgomeryfertilitycenter.com. And before we begin, I want to share something close to my heart. My upcoming book, The Quest for Fertility, coming spring of 2026. This is a must-read for anyone preparing for fertility, thinking about preserving it, or supporting someone on that path. What makes this book special is that it goes beyond the science. It's soulful, a story-driven exploration of real patients' journeys and how they found hope, healing, and strength through fertility challenges. If you'd like to join our Quest for Fertility support circle or get updates about the book's release, visit montgomeryfertilitycenter.com and send us an email. Now, let's dive into today's episode of Fertile Talks, where we'll explore the science, stories, and soul behind the journey to parenthood. Hello, everyone. This is Dr. Famuyiwa again with another episode of Fertile Talks. So tonight we have a treat for you. We have a special guest. Her name is Dr. Nadia Sirdar, right? And
Yes.
she's a primary care doctor doing direct primary care. But I brought her on so that we can discuss the role of primary care physicians in patients first encountering their first fertility visit. So, Nadia, thank you for coming.
Thank you for having me. I'm so pleased to be here. Thank you.
Awesome. Can you tell our audience a little bit about your background, what you do, and how you got here?
Sure, absolutely. So I initially started in public health. I did global public health and worked in different parts of Africa doing HIV/AIDS, and always saw myself in that role. I actually went to med school later as a second career. And when I was in medicine, I was sort of very intent on doing infectious disease. And I did some a fellowship in infectious disease. And really what sort of led me to where I am today is I spent the last few years in hospital medicine and kind of saw people at the end of a disease process where I found that there was so much that could have been done before they got there. And really my mission...
Before you go on, where'd you go to medical school?
UT Southwestern in Dallas, Texas.
Where'd you go to your on fellowship?
So my fellowship was at Georgetown.
Oh, awesome.
Although I don't practice infectious disease, but that's always been a passion of mine. So I did do the fellowship there. And then I actually left in the middle because it wasn't what I really envisioned. And I took the hospital medicine job thinking it was something in between before I figured things out. And then 9 years later, here I am starting primary care, and I'm so excited.
Yeah, but you know what? So many people in life don't know that they can course correct. And you have to course correct to what brings you fulfillment and what brings you joy. Like I started doing a lot of bench research at NIH, but then I realized I actually enjoy patient care more. So I course corrected into private practice.
I love that. It's like you're always ready to pivot. And frankly, I think reinventing yourself is half the fun.
Oh, absolutely. So I want you to, I know you do direct primary care in the close to us over here, right? Where
Hmm.
is your office? When did you
Absolutely.
open it? Why did you open
Yeah. So my practice is called Bethesda Modern Primary Care. I'm in Bethesda, Maryland at 5272 River Road. So I'm right across from the Whole Foods. A lot of the women I talk to ask me, are you next to American Plant? Because that's like the place that everyone goes to.
it?
But I somehow got lucky with this BethesdaDoctor.com website.
Uh-huh.
And I have been open for a few months now.
Awesome.
I dreamed about the process starting in January, but I
Yeah.
started seeing patients in the last few months.
Awesome. So this is new.
Yeah,
Well, I'm so
it's a little bit new. It's a
yes.
little bit new
So
and fresh and exciting.
right. So the reason I brought you on is to talk about the role of a primary care doctor
Hmm.
being the gatekeeper for fertility care, really. We know that a lot of women are busy in their lives. They may
Hmm.
not even see a gynecologist, but sometimes they'll go and they'll see their primary care doctor because they want, one medication or the other.
Right,
And that role may be the start of their fertility journey that ends somewhere in menopause, right?
right,
So,
right.
if you were to see what age range of women would
Hmm.
you see, and how would you engage them in that initial dialogue?
Absolutely. So, as an internal medicine physician, I see everyone 18 and up. There's different sort of populations that come to me. I think the folks that are sort of really attracted to this model are very busy young professional women, often really high achieving.
Exactly.
And so they put everything else sort of as the highest priority, and then their own care is kind of the last.
The last
So
thing.
for these folks, I think the most important thing is to ask them about their sort of reproductive life
Yeah.
and figure out, in a very sort of non judgmental, comfortable way
Exactly.
where they're at,
Hmm.
what's their history. And then if I hear red flags, to sort of probe further and make sure that we get them to where they need to be, um, namely someone like you.
Mm. So, but Nadia, one of the things that I always tell people is, um, you know, fertile eggs means fertile body, right? Even
Right.
for men, fertile sperm means fertile body. What are
Hmm.
the things that in your practice that you do to get people to say, hey, listen, let's take care of this body? Because if the body, is not right, um,
Right.
it's very hard to get you know,
Right.
pregnancy. So do
Right.
you have any, like, say, do you have a 5 plan system or a 6 point plan and say,
Sure.
here's what you need to do to get into a healthy body?
Sure. So I think the most important thing is first to develop and have that relationship where somebody's willing and able to talk to you about really intimate details of their lives. So, for example, have you even thought about planning for a future pregnancy?
Mhm.
And do you have a partner, or is this something you would want to do by yourself? And what's your life plan for like 3 years from now, 5 years from now? So, even just to sort of start that conversation about when I do the review of systems, I'm looking at, is this person at risk for obesity, diabetes, obstructive sleep apnea? There's so many bread and butter primary care issues that come up that are
Exactly.
going to negatively affect their fertility.
Right.
Um, and a lot of it too is education. So
Right.
people will tell me all the time, well, oh no, I won't, I don't need to go to a fertility person because I just have to wait for 9 months or 12 months and
Mhm.
then I can go to them. And I have to educate them and say, actually, there's no cutoff. Like 4 months, right? Greater than equal to 4 months is
Six.
premature ovarian insufficiency, right? So or 6 months. I mean, I think the point is to say it's better for you to get help earlier
Right.
and
Right.
have that conversation with me so that I can get you to the place that you need to be,
What
right?
if somebody comes in and they have a BMI of, say, 45? And
Right.
then, because I'm going to send them back to you and say, we need to help this
Right.
patient unless they're cancer
Absolutely.
patients. How would you
Absolutely.
coach them or help them to say, okay,
Sure.
here's our strategic plan to get you in a good
Right.
shape?
Absolutely. So first I have to sort of figure out if they're in a place to hear that message, right?
That's true.
Because a lot of the folks that hear that think it's like a blaming type of
That's right.
thing.
They're triggered. Yes.
Right. They get triggered or they feel like, well, I've been doing everything right, but I just can't get
Yes.
there. So
Yes.
I think the number one thing is to even have that lifestyle conversation.
Yes.
Are you traveling a lot? Are you eating out a lot? Do
Hmm.
you have like a lifestyle that's going to create something where we can have structural interventions and have meal planning and nutrition and exercise? But of course, if somebody is to say to me, for example, I've done that all and it's not working for me, then, we have luckily found that GLP-1s are very helpful.
Mm,
And we
mm,
have to talk about, do you have sort of a sensitive GI history? Like, are you somebody with IBS or somebody who gets
mhm.
nauseous really quickly? Maybe they're not the best candidate, but if they are somebody that would consider it or even consider starting at a very
Yes.
low dose, I
Yes.
think that's something that's reasonable.
Absolutely. And I do encourage you. I think GLP-1 has a role in fertility care. What you
Absolutely.
just mentioned, something I've been discussing with a lot of people is
Hmm.
I believe that if you're going to be on GLP, you need to be under a care of a physician. I know
Absolutely.
you can get it in shops nowadays. You can go to any
Right.
old med spa. You can go to it from online, but
Right.
there are reasons why you want to be under the care of someone that
Absolutely.
knows how to use these medications. What side effects would you warn people about?
So everybody reacts differently, but one of the most sort of common complaints are early satiety, which
Mhm.
means like you feel like you're full quicker, but that also is correlated to like kind of like a decrease in your motility of your gastric
Right.
system. And so essentially it feels like you're full and it can even make you feel a little nauseous or bloated. So those kind of symptoms you have to sort of warn folks about and
Mhm.
help them understand that like smaller meals and taking in protein first is really important. Number two is actually like losing your hunger completely. So a lot of people don't understand that you might go from a lot of food noise to zero. And
Yeah.
so they're walking around working and thinking, oh, I forgot to have breakfast. Oh, I forgot to have lunch. And that's not the right way to do this. We have to make sure that you're taking in the right macronutrients and micronutrients. And especially in folks that are in their childbearing years, you know, this can cause muscle wasting or sarcopenia.
Yes.
And
Yes.
you have to make sure you have muscles that are
Yes.
strong and good. You're going to carry a life into this world. You need to make sure that you're strong enough
Right.
to do so, right?
So, folks, sarcopenia means muscle loss. That's
Muscle
one
loss.
thing that most
Exactly.
people don't realize that if you're not under proper care, if you're under care of
Right.
someone like Nadia, she's going to make sure you take your protein intake so that that
Right.
muscle loss doesn't happen.
Right.
Correct? So,
That's
yes.
exactly right. Well, another side effect that people probably may have heard of or may not, I have seen patients end up in the hospital with pancreatitis. That's another, kind of subtle findings in the beginning where they have epigastric pain, which is pain kind of in the upper, like middle of their sort of where their
Mhm.
esophagus is. And nausea, and it might be very subtle. So something like that would make us want to pause, right, and kind of move through that. So I mean, there's smaller sort of
Yeah, but wait,
symptoms
let's
and side
talk a
effects,
little bit
but
of,
some,
yeah, let's talk about this because people don't
yeah,
realize if you go online and you take this thing and you start to
yeah,
get a pancreas, that's your pancreas, people. That's where
yeah,
insulin is made.
right,
And if it starts to affect the pancreas and you don't stop it because you don't know,
right,
what could be the potential, like worst case scenario for people who
right.
took it over the counter and their pancreas gets a hit and they have no idea?
So, first of all, anybody who's had pancreatitis knows it is extremely painful. And we admit patients to the hospital and we basically tell them, you can't have anything by mouth. We can only give you IV fluids. We can give you dextrose, but essentially you have to be what's called NPO or nothing by mouth until the pain resolves. And frankly, sometimes even pain medicine is not helpful. And it's like you have to kind of like ride it out. And I wouldn't wish it on on anyone because it
Oh
is
my
really, I mean, it's
God.
very, very painful. And then the number two, what you said was if you have an acute pancreatitis, hopefully you recover. But the concern is if you have a low grade chronic pancreatitis, then over time you can also have, breakdown of the things that it does normally. So and exactly what you're saying with the metabolism and insulin producing cells and sort of treated,
But we're
you
going
know,
to
if
say
you,
it a little bit louder so the people in the back can hear.
okay.
Take GLP-1 under medical supervision.
Yes, please.
Suffice to say,
Please have a medical doctor take care of you.
yes. Yeah, it's not something you can do alone.
It's not
ChatGPT wouldn't help
benign.
you with this one.
It's not benign. Yeah, exactly.
So
I
that's
agree
really
with that.
good. So we talked about the weight and how to approach it and the pancreas,
Yep.
and also with compassion, because this can be triggering and people have to
Right.
be ready to talk about it. But what
Correct.
about people who have, I had a patient who um her blood pressure is 160 over 110. I'm like, I can't help you here. We need to
Right.
fix that first because you could get
Right.
potential complications,
Right,
right?
exactly. So one of the things I don't think people are actually aware of is that different ethnicities have different medications that work for blood pressure control. So when you have a physician who is aware of your ethnic background, so for example, South Asians or African Americans or an East Asian with smaller BMI,
Hmm.
different medications work for different people. So
Exactly.
number one, you need a physician that you are going to be in touch with. And what I do is I ask them to get a blood pressure cuff for home
Hmm.
and bring it from home and make sure that we calibrate it with our blood pressure cuff here in the
Mm,
clinic so that
mm,
when they're taking their measurements at home, let's say we start a new medication, I say, please take it every single day, put it in
mm,
your notes of your phone, send it to me at the end of the week. We can
mm,
see if we're making progress. And
mm,
slow and steady kind of wins the race, right? So we start at the lowest possible dose. We go up from there with the target of having an ideal blood pressure, less than 130 over 80. But you're not going to get there in a week or two. Probably it would take like 12 weeks.
to okay, so
So
if
6 to
you
12
have,
weeks, I think. I
yeah,
mean,
if
people
you
can
have
respond
uncontrolled high
faster,
blood
but
pressure, those are
yeah,
the things you need to take care of before we
right.
even start talking fertility treatment, right? Because,
Well,
high blood pressure, if not properly taken care of, can be a silent
right.
killer.
Right, absolutely. So I mean, there's so many effects. It affects your kidney. It can be a stroke risk. There's, a whole laundry list. But I want to connect it back to the fertility
Mhm.
issue because I think you, Dr. Yemi, when we went for our walk, you mentioned
Right.
that, the sort of when the eggs are being, released, it's like there's a big lag in time, right?
Right.
So
We call it being recruited, and they're
recruited,
recruited in waves,
right,
right? And the
right.
waves start, further back in time than people realize.
That's right. So I think that's the important part where you have somebody to hold your hand and be your advocate, but also to keep you accountable and say, look, if you want to conceive in the next 3 to 6 months, this is our timeline and this is how much time we have and this is what's safe. This is
Yes.
how much we can go down in our numbers. And really a lot of that, for example, blood pressure is very closely related to obesity, class 1, class 2 obesity. So
Yeah.
as you start to decrease your weight, you'll see people's blood pressures come down and they a lot of times come off those medications.
Yeah. And interesting that you said that. There was a recent article. Actually, I did a blog on it where they showed that even in men who have subclinical high blood pressure,
Mm-hmm.
there is an impact on their semen analysis. Even in
Hmm.
men who, don't have your full blown 140 over 90 or more, between 120 to 140 and between 80 to 90 diastolic, they did have some effect on their semen. So, taking care of these things before you even venture to the fertility doctor is really crucial. It's,
Right,
we sometimes treat um, different specialties as if they're in a silo. But,
right.
that's
And it's
premature
not.
over there, and that's fertility,
Right,
but it's really not. It's
right.
just a continuum of health, really.
I think so. I
And
and I
that's, yeah, go ahead.
No, I was just going to say that I think like everyone is so kind of they're so focused on the goal of getting pregnant that sometimes we forget like after 9 months you're going to have a baby and you're going to have another human being to take care of. And so, what are the sort of foundational things we can set up to set you up for success, right? And that means that we are talking about the lifestyle and the diet and the structural interventions that might be helpful, but also what medications are safe and what medications can we stay on, which ones do we really want to come off of, and that type of thing. Because obviously, they come and they want to have the success of fertility and getting pregnant, but there's this whole world that happens afterwards, and I'm still there for that.
Exactly. Exactly. Well, thank you so much for your time tonight. I hope
Thank
that
you.
this has shed light for some of our general audience to say, hey, listen, your overall wellness is really one and the same with your fertility journey, and it starts
Mhm.
there. So let's
Mhm.
start taking care of yourself, being the healthiest person you can be. See someone like Dr. Nadir, and before you even think of starting a fertility journey.
I
So
think
let
that's
me,
a fantastic message. Go ahead.
no, go ahead, finish it. Yeah, yeah, yeah.
No, I was just going to say, a lot of people have asked me what direct primary care is, and I think it's helpful to sort of explain it
Yes.
because they ask me, like, are you concierge? That sounds really expensive. What is that exactly? I have insurance, so I don't know if I would spend extra to do that. But really, the direct primary care model is fantastic because it basically it takes away the noise of the insurance companies and allows you to have a relationship with your physician. So it's a membership based model, almost like going to the gym, and you pay for the year, like annual, semi-annual. And the new laws that were passed in the federal government say that starting January 2026, you can use your HSA up to
Yeah.
150 US dollars a month. So that's kind of amazing, right? So instead of spending your HSA on your like skin serums, you can get a Yale educated primary care doctor in your back pocket. I think that's a pretty good deal. So, the way that I like to explain it to folks is you don't know when you need a doctor until you really need them.
Mm.
Right. And so you want to have that relationship. You want to have somebody you trust so that if something comes up, God forbid, you have somebody that you could ask for help and they will get you in the same day. So
Awesome.
that's kind of what direct primary care is.
Awesome. Now, Nadia, let me ask you, where
Yeah.
can people find you? How can they reach you if they want to reach you?
Oh, okay, so we have a website, BethesdaDoctor.com, and they can book a discovery call
DR
through
or
there.
doctor all the way?
So Bethesda, Bethesda,
Uh-huh.
doctor with an O, doctor
Correct.
.com.
Okay.
And then we have at Dr. Nadia Sirdar on Instagram and on LinkedIn. And I think I just started a TikTok, but I might have only one or two
Oh,
videos on there. So I keep forgetting my login because I'm not a
yes.
super frequent user. But essentially, everyone younger than me keeps telling me to get on there. So I finally did.
Awesome. Well, thank you so much for spending this evening with us. We appreciate you. And
Thank you.
folks, you heard it. You can reach out to Dr. Nadia anytime you want.
Thank you so
Thank you.
much. I
All
appreciate
right.
it. Take care. Bye bye.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.